Good morning. Welcome to the Dr. Powell Show. I'm your host, Dr. Keisha Powell. Today we're going to talk about autism and what supports caregivers or parents receive here in our Nutmeg State. Autism for many is not always understood. And here on the Dr. Powell Show, we're going to talk about how parents and caregivers are supported. According to the Center for Disease Control and Prevention, autism is a neurological disorder which affects the brain in how a person communicates, interacts socially with others, behave emotionally, and shows restrictive and repetitive behaviors. 1 in 36 children were identified from different ethnic backgrounds, and according to a 2024 report, autism is 4 times more common in boys than girls. Parents and caregivers continue to require support. After the commercial break, we will speak with a parent who will share their story and their journey about autism. Welcome back. Here today to share her experiences is Ms. Shanira Billups, licensed professional counselor, a professor, and a parent. Welcome to the Dr. Powell Show, Mrs. Billups. How are you?
I'm well. How about yourself?
It's nice because the weather is nice. I was able to do a 2-mile walk this morning, so I'm really feeling happy. We're really grateful that you're here on the show, not just to only share your experiences, but to perhaps share with our viewers about some of the challenges that you've been through. But before we begin, would you mind telling us about yourself?
Absolutely. I am a very awesome mom, AUSOME, proudly of one young, amazing Black boy. He's 11 years old, and his name is Mally for short. And I am a practice owner, Mental Growth Internal Healing LLC, which serves individual group sessions, all sorts of services circled around behavioral health and wellness. I sit on a number of boards for nonprofit organizations. And I'm a co-founder of a nonprofit organization particularly called Altogether Healing Incorporated, which focuses on environmental wellness in communities and helping to kind of fill in gaps as far as programs, education, information, and support around emotional development. I am also an adjunct professor with Southern Connecticut State University in the psychology department, and I also am a doctoral student for counseling, education, and supervision, hopefully in a few more years. So I do a number of things, and overall, sorry for the background noise. Overall, I am a person of adjustment. That's my whole life, adjusting and understanding my environment and the way it impacts me. So that's just a little bit about myself.
I love how you say that you're a person about adjusting. I'd like to borrow that one because I think that's not only powerful, but very profound, especially for parents who are diagnosed with awesome children. And as a parent of a child diagnosed with awesomeness, what were some of the challenges that you faced that you could share with us?
Ooh, the challenge that I definitely faced was understanding how important it was to be patient with myself. So that I can also be patient with the situation. No one wakes up and says to themselves, I want to be the parents of a child or children who are facing challenges that has to do with their social emotional development that they are really going to need my investment in, that I will have to go ahead and sacrifice some things and figure things out through while still managing life as usual. Life happens, and it's important to realize as life is happening for myself or for anyone who is a caregiver for him, life is also happening for him. And he's picking up on everything that is being done around him and including people and their actions. So having that patience with myself has been looking more like, okay, things are going to be perfect. There may be some hiccups here and there. Let me figure out how to problem solve around it. And I find that when I show myself that patience, I'm able to also come from a better place of understanding for my son, as in terms of his not understanding or picking up on things as quickly. Because I've given myself that opportunity to figure it out and apply those problem solving skills, and so I can model it for him through my demeanor and as far as the way I communicate with him. So patience, big factor.
It indeed is a big factor. And how did you navigate these changes? How did you overcome these challenges?
Really focusing on the communication factor and being able to accept help.
Mm.
Accept help. I feel that uh, actions can speak louder than words, and sometimes we can even show actions as far as not intentionally, but it happens anyways, and people can pick up on uh, what may be needed depending on if those individuals are mindful or observant. And sometimes where we falter at is not accepting the help that is provided, or even if we do, let's say we do say, all right, I need help in this, or we start complaining about something or whatever the case may be, and individuals come with a solution, and it can be challenging to trust at times or open up. And that had been one of the hurdles for me as far as not only communicating, because I could communicate with people all week long. That's just basically what I do at the center of it, but how much of it I made effective in terms of not only advocating for what the needs were, but really um, understanding when people provided assistance or when assistance was made available to be able to grab hold to it and apply it as it is useful. And whatever it is that I even take on, and if I didn't use that particular resource, being able to also pass it on to a parent who may need it, knowing that for me, that was also important as far as the connection. You find that one can find themselves even more deeply rooted or connected to individuals when they take that approach. Just because it may not be useful for you doesn't mean that it can't be useful for someone else. So staying open-minded in that sense was for me a saving grace, just to be stable and even being a single mother, handling the things that I do. Not to say his father is not involved. However, I do take on a big role for our son's development. And so for me, that communication factor, that openness, that advocacy is super important to help with the balance, because it doesn't always look like, stable shelving is sometimes a little crooked. And just being able to be okay with that, sit with it, and figure out what needs to be navigated around and addressed accordingly. So I've been able to do it. Communication.
I want to applaud you for just sitting and listening to not just what you have had to overcome and the strategies that you use to navigate your story. But when I even in my profession, when I listened to parents, and I remembered back in 2005, there still was not a lot available for parents in terms of resources. And so there were different groups that were there, but a lot of what I'm hearing now, and now we're in 2025 and still hearing your journey, it's very suggestive that we still have far to go. And so all I can say to you is I salute you today for the fact that you have taken so many steps, and most of all, not only in terms of advocacy, but also in allowing yourself to accept help, because many parents don't accept help, especially in our community. Have you been able to find resources to get help here in the state of Connecticut?
I have. That's again where it's important to be vocal and understanding that accepting resources is not a sign of weakness. Accepting resources is um, not going to put a person at a disadvantage. It's like one of the big myths is like, oh, I don't want to be labeled. I don't want to be labeled. I don't want to be labeled. But right now you're labeling yourself as being at a deficit and you can never achieve anything because you ain't open up your mouth. Like a closed mouth doesn't get fed. And so with the resources as well, they're made available. I feel that there's a lot of the sense of equality versus equity with some of these resources. And so even going back to earlier when I said just because you get a certain resource or something that you may not be able to use doesn't mean that you don't pass it on. Due diligence. I feel it's a due diligence to be able to share with the next person, like no gatekeeping with it, because resources can be challenging to come across, or understanding how to navigate those resources can be challenging as well, especially when you're brand new to it. When you're a first time parent and dealing with uh, neurological disorder and having to understand how to parent the way that your child needs it versus doing it maybe a traditional way amongst others that might be peers or may have children along the around the same age as your child. The resources are here, like with NCT is you can one of the big things to say is contact 211, and absolutely, because that is the given resource as far as information, sometimes is not as effective as individuals might put it out there to be. But it also depends upon what you're looking for and who is on the team of resource providers, how knowledgeable they are of it, how they know how to navigate the system. There's also good old fashioned searching for oneself online. But it's important though to also understand what it is that you need, being able to put a name to it. And so I also encourage individuals to go see a specialist or provider, reach out to your child's pediatric specialist or pediatrician if they are over that age. Of course, it would take some navigation in terms of just being their representative, but finding out the steps to make that connection to be able to manage their medical, whatever the case may be, because the primary care physician can be a great resource for if they specialize in that area. It could be a great resource to help parents out. Also, there's different organizations that do provide advocacy for youth dealing with neurological development disorders, including especially with autism disorder, autism spectrum disorder, and of course, again, if you search through for that, you can find a variety of organizations, including Autism Speaks, and there is another one. I don't think it's called the Kennedy Initiative, but it's definitely a center that specializes again with the full-on support of youth and young adults who are challenged with neurotypical kind of behaviors or neurodivergent behaviors. Sorry.
Thank you so much for sharing that. In fact, I think you probably answered or one of the questions I was going to ask you. And thank you, because I hope that viewers out there who are parents who have or caregivers who have children diagnosed with autism will take into consideration some of these resources that you've mentioned, because now we need more help, more resources for parents than what we've had before. What advice, if it's one or two, what advice would you give to other parents now that you're going through this journey, perhaps parents who are just beginning this journey? What advice would you give
Try
them?
to fit. Don't try to fit a mold. Don't try to fit a mold. You'll find yourself putting your own self at such a disadvantage if you are trying to fit in a just one area as far as parenting for youth on the spectrum. If we're talking about, and particularly to uh, parents who are awesome parents, they are different. Youth who have autism spectrum disorders, they're different. They have similarities, but definitely differences. It's just like with snowflakes. I see them as snowflakes with a bit more sparkle to it, a little bit of spiciness to it. Um, it's important to just let your senses be engaged when it comes to engaging with them. Parenting a child for me, in terms of personal, is become such a wonder. I've really let go of the sense of just having that heightened expectation according to societal demand. In the beginning, it was rough. I'll absolutely admit to that. It was hard because when you have it where your child is receiving a diagnosis that you didn't think would be within your realm of dealings, it's like you're wanting to figure out how to, like, even out there to say fix it. There's no fixing yet. There is adjustment. And that's why even when we started, I said I see myself as a person of adjustment. I'm a person of adjustment because I'm okay with having to shift and move because that's just how life runs. And I feel it's been such a blessing to have my son in my life because um, with the willingness to make all these adjustments as I have, he has certainly and continues to grow into such a pleasant, um, colorful, engaging young man. He still loves his space. He still has uh his challenges. Um Still mostly nonverbal. He speaks with his face, and I tell him sometimes, "Don't talk with me. Don't look at me in that tone of voice." You know, but I'm able to find ways how to communicate with him, and now he's actively trying to hold conversation that is meaningful. But all that comes from the willingness to adjust and letting go of whatever my own idea was of a normal child. There is none, but embracing his strengths and being able to look at the weaknesses he may have, but say, it's okay because not all of us are the same. He's definitely different. And whenever something is at a default or it doesn't work out the way you want it to be, there's something else that can grow stronger and can help to even the playing field. And I didn't want to shortchange him by trying to make him be what it is that I want him to be. And because I let go of that and see him growing into who he needs to be to manage the world that he's living in. So I'm happy. And I'm excited about what the world's going to bring because he's in the preteen years.
Fun times. You
No,
know,
it's beautiful.
it is beautiful. It's beautiful. It's beautiful, that process. It's a as I always say, autism isn't tragedy, ignorance is. And, you know, I want to put out there for our viewers that Miss Billups, her company, she's Altogether Healing LLC. She also helps a lot of parents who have neurodiverse individuals. You help so many people, still helping people. How could viewers, if they should need help, even just with, you know, a conversation, how can parents reach out to you?
Oh yes, parents absolutely. I feel they as being caregivers, they need some of the biggest support. I strongly recommend getting some some kind of outside support outside of just family. You know, you can talk with family, you can talk with friends. That's great. Sometimes, though, you need to give yourself that permission just to let down and have it where someone, a professional, is able to be present for you in terms of the just processing situation, but also can take what you're processing and apply knowledge and structure to that process as needed. And not have to have the burden of do they actually know what they're doing when it's like that's what they're in place for. Alleviate yourself of that. So parents, please manage to get yourself some kind of assistance. Don't entrap yourself in the everyday trying to figure out, okay, how do I do this today? How do I do this today? You have to have your 5 minutes or 15 minutes of just setting to the side. It may feel like it's really hard to do or impossible to do, but it's also what you make it. Again, letting go of your what you normally feel that it should be in terms of a break. It may not look like the same for you, but make it work where you're able to take that own time to kind of let yourself go. And that way it doesn't trickle down to the child or impact them negatively. So, yeah, I would say that I have behavioral health services. My in terms of delivering the behavioral health services, mental growth, internal healing LLC, which we provide the counseling based services and more the therapeutic support. And then with Altogether Healing Incorporated, as being co-founder, I do a lot of program development, and some of the programs are, you know, for children and families, so that they can spend more time intentionally engaging in activities that help them out as far as managing their environment. So providing that very solid support to help parents and children alike feel grounded and be in a safe space to do it.
Thank you so much for what you're doing for so many. And thank you again for sharing here on the Dr. Powell Show. I cannot say it enough that you are super awesome. And thank you
Oh,
for sharing your journey about your own awesomeness as a parent to an awesome child. Thank you again for
thank you for
joining
your
us.
contributions, and we appreciate you as well as far as the work you do. Absolutely great. I would couldn't ask for anything more as far as colleagues are concerned.
Thank you. Okay. Thank you so much.
Take care. Thank you. Take care.
We've heard from our parent, and we thank Miss Billups for being on our show. There are a few resources that I would like to share with parents that are available in our state. Autism Services and Resources of Connecticut, CTARC, Hartford Hospital Autism Institute, the Department of Public Health's website for autism services. They provide a list of providers as well as different information that would be helpful to parents and caregivers. And Powell Therapy Solutions, LLC.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. so he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I had something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Again, thank you for watching the Dr. Powell Show. Stay tuned next time for a new episode.